Okay, good morning to all our media partners, CHDs, and everyone who is watching on YouTube. I am Jolo from the DOH Communications Management Unit. In our Kapihan today, we'll have a deep dive and in-depth look at the country's most pressing health issues. Here to give us a discussion on disaster preparedness and resiliency amid the COVID-19 pandemic is Dr. Ronald Law. He is currently the OIC Director 4 of the Health Emergency Management Bureau. Dr. Ronald.
Good morning, Jolo, and to all our DOH colleagues and, of course, very important media partners. So I'm very glad to be here. So I hope you have a safe, pleasant, and blessed morning. Thank you.
You may start na po.
Okay.
Ah,
So may I request for my slides to be projected? Yeah. So the purpose of this is to give you some inputs and insights on a very important topic that we have to talk about in the midst of our COVID-19 response. So the title of my presentation is Disaster Preparedness and Resilience Amidst the COVID-19 Pandemic. So it's very important for the government and its partners to work together to do a lot of strategies, no, to make sure all of us are safe, and not only because of the from the pandemic, but because of the impacts and consequences of different emergencies and disasters that can happen, one on top of the other. So this is important in terms of us communicating what we're doing, and I know that media partners are our allies. So we'd like for you to get a deep dive into what were the tips that we have. So if I can have the next slide, please. Thank you. So this is the big question. So why do we even have to bother about talking about disaster preparedness and resilience during the COVID-19 pandemic? The first point is that we have what we call concurrent emergencies and disasters. So just because COVID happened, it doesn't mean that other emergencies and disasters, which are more common, especially in the Philippine setting, will disappear. So these are happening one on top of the other and complicating further our pandemic response. So case in point, if you may remember last year, when we were in the thick of our battle against COVID-19, the last part of 2020, we had to grapple with the consequences of typhoons Rolly and Ulysses. And Ulysses was the worst typhoon that we had last year, right? So it killed around 100 people and brought about like 20 billion in terms of damages. So, and more than that, it made our COVID-19 response more complicated. So what are you gonna do with the TTMFs, no? What are you gonna do with displaced people? So how do you make sure that the minimum public health standards are still observed? And how do we do our relief efforts? How do we deliver our services? So these are things that are happening, and this is a big challenge to us. And then, of course, when we talk about disaster management, we must be very good in terms of ensuring that our health services are continuing. So, for instance, last year, we issued out Department Circular 2020-0167. So this talks about the continuous provision of our essential health services during the COVID-19 pandemic. So here in this particular policy, we we said that health facilities must remain open. So if you close them, so how are we gonna deliver our health service? Here we also talk about the need to mobilize different response teams, how to stack up on logistics. So these are the very basic preparedness and the response activities that we must still continue doing, even if we are doing our COVID-19 response. So the needs of people during disasters do not change. So we have to be able to continue providing these services. So this is easier said than done. No? So there are things that we need to put in place just to make this happen. And a lot of coordination has to be done. A lot of logistical requirements have to be thought of. So the mechanism, the frameworks of response should be very clear. So just because there's COVID, just because there's our emergencies and disasters, so all of this point out to the need to really make sure our health services are continually delivered. So this is a very important principle. Third point is that when we talk about COVID-19 response, we should consider disaster preparedness. Like I made reference to the fact that when the TTMFs, our quarantine facilities, for example, will be affected by floods, so how are we gonna undertake our evacuation plans? How are we going to transfer our patients? So now we're doing ramping up of our vaccine operations. But what if power outages happen? So do we have the backup systems in place? So we cannot afford to lose the vaccine potency just because of a power outage, right? So these are practical things that we should consider. So therefore, these should form part of our disaster plans. So we have existing disaster plans, but we have to make sure we have plans to ensure continuity of services. We must have plans to have contingency measures. If, for example, the local government cannot address the requirements. So how does it solicit the support of the Department of Health? So how do we tap our private sector? So how do we utilize our NDMC mechanism to make this happen? So there are many scenarios, there are many points to consider when we talk about COVID response from the perspective of disaster preparedness. So the plans must be there, logistics must be there. We have to have standby medical teams, and there must be this whole of society approach as well. No, so when we talk about disaster preparedness, that is very important also when we do our COVID response. But when we manage the health consequences of typhoons, volcanic eruptions that happen simultaneously, same principles would apply. And the big buzzword, of course, is health resilience. So now we are doing a lot of COVID response, but as we transition to recovery, going back to normal, I mean, so we have to factor in resilience. And resilience should really be spelled out. This should be operationalized. This should be very concrete in all our plans. And when we say health resilience, this is where the important role of the local governments, the communities come in. So some principles of disaster risk management, in fact, are also being applied now to what we're doing for COVID-19 response. Because at the end of the day, technically, COVID-19 is also a disaster by way of the different consequences that it gives us. No, so we have problems on health, we have problems on the economic side, and all sorts of things. So disaster preparedness and resilience, I believe, should be operationalized, no, and concretized, especially now when we're faced with our COVID response. Next slide, please. All right. So we have to be particular about uh, what hazards should we be prepared for. Okay, so of course, Philippines is for the most part facing a lot of natural hazards and disasters. So this is our perspective in the Philippines. So we must be prepared for the natural events, no, from flooding, landslides. So in Ulysses, many people died because of the flooding. So the communities were submerged under floods, no, for many days. Storm surges, of course. The thought of the big one, we cannot erase that. And of course, lately we've been monitoring lots of high magnitude earthquakes. Of course, volcanic eruptions. So we must remember that before COVID-19, we had to be we were responding to Taal, right? Taal volcanic eruption. And of course, human induced. So some parts of the country are facing armed conflict concerns, insurgencies, of course, the threats of terrorism. So we call this our all hazards approach. So practically speaking, it's better if we are considering most of this. And we should not only be prepared for the major disasters, meaning to say the big ones that are of big magnitude. We also must look into like fire. Fire is a very common hazard. So you remember when the Philippine General Hospital, had a fire incident. So it was a huge challenge how to transfer COVID-19 cases. So how do you make sure no one dies, no, just because of the fire? So that in itself is a big challenge. So how about power outages? So for the past few weeks, we've been having rotating brownouts. We've been having typhoons, no? So Dante just exited, but for the past 2 weeks, we were busy monitoring our vaccine centers, looking into their power outage concerns and connecting them to the local electric companies, to the Meralco, and to other partners who can provide the needed resources. Equipment failure. Yeah. So, for example, when we do our vaccination rollout, we rely on ICT, no? uh, data, so power. So these are important as well. Transportation accidents. So this is very true for geographically isolated in these disadvantaged areas. No? Like there were instances wherein we had to transport the vaccines via water, no, sa dagat, no, and then sometimes there could be transportation accidents. So we have to look into this, and of course, biological wise, of course, aside from COVID, uh, communicable diseases. So if we're not careful about implementing the minimum public health standards, like if you violate all of these protocols, so there can be diseases that can be easily transmitted as well. When we're not particular about ventilation, about distancing, and then of course medical emergencies as well are there, and environmentally, so we can have problems with infectious and general waste, sharps. So most of these are particular for our vaccine operations. So this is the one of the latest one we came up with in terms of what vaccination centers should look into. So now we are requiring all vaccine centers to come up with their own public service continuity plan, precisely because of these problems. So now we are planning to conduct a drill to test how responsive their plans would be as far as these different hazards are concerned. Okay, so of course our focus now is the impacts of natural disasters, but when we do our planning, it would be good if we really practice what we call the approach. So, but this will depend, of course, on the perspective, the context of the different communities that need to come up with these different kinds of plans. Next slide, please. All right. So this is a basic question. So what health services do we deliver in emergencies and disasters? So this is already given. So this is very explicit in some of the policies that we were already able to issue. So this still holds true even for our COVID response. So we have what we call essential health service packages in emergencies and disasters. So just to give you a better idea, so the health sector as led by the Department of Health, when we have emergencies and disasters, so our bureau usually would be very busy looking into all of this. So we are responsible for providing what we call quad cluster services. So there are 4 groups of services that we need to be able to deliver to people affected by emergencies and disasters. So the first classification is medical and public health. So here you can see the different life-saving measures, basic life support, first aid. Here we have prevention and control of communicable diseases and even non-communicable diseases, hypertension, diabetes, maternal, newborn, and child health. This is very important. Sexual and reproductive health, early treatment and continuation of treatment for acute and chronic conditions. So, of course, sometimes we need to provide supply of medicines. This is important. So there are medicines that uh, what we call maintenance meds, no, especially for non-communicable diseases. Sometimes we have to provide medications for acute conditions. For example, antibiotics. If people will develop, for example, that's very common, acute respiratory infection, no, and then providing health support services for vulnerable population. So this is given, and we make sure this also get delivered. No? So even in our COVID response, we are looking into this, and these are things that need to be provided still. Next slide. All right. So the second grouping pertains to nutrition. So here, this includes our community health and nutrition interventions, infant and young child feeding. Of course, you know how important nutrition is in terms of a predisposition to diseases. And we have in the population what we call different vulnerable groups, no? Pregnant lactating women, children. So we must be able to support them in terms of their different nutritional requirements. So sometimes we have to provide micronutrients, managing malnutrition cases. Sometimes we need to refer them to hospitals. This includes supplementary feeding, counseling and supportive nutrition care, and even monitoring the Milk Code Act, because breastfeeding, as we would like to say, and this is very explicit in the Milk Code, but sometimes there are violations. We still promote breastfeeding. Okay, so we do a lot of health promotion in emergencies and disasters for different uh, conditions and purposes. Next slide, please. Can I have the next slide, please? All right, this is very important, water sanitation and hygiene. So during disasters, one slide back, please. Wash, okay. So outbreaks of diseases are very common. So what we usually encounter are gastroenteritis or diarrhea, no? And much of this is related to the quality of water, the sanitation conditions, and hygiene practices of the population. So WASH is a very important component of our services. So this is in the context of displaced people inside the evacuation centers. So here we do WASH assessment and evaluation. We have to provide safe water, storage, and protection of sources. Here we do intensive hygiene promotion, washing of hands, vector control, provision for solid waste management, down the line. No? So even the wash facilities. So wash is a important component of our services. And lastly, the last group of services is, next slide please, mental health and psychosocial support. Yeah. So aside from the physical impacts of a disaster, we need to look into the mental health aspect. Here we talk about providing PFA or psychological first aid. We use a different range of approaches to facilitate a healing, referral of cases if necessary to our specialist and to our higher facilities, uh, referring patients to psychiatrists, psychologists, for example, providing community mental health education. This also includes our mechanisms to protect and promote the well-being of our responders. And if necessary, we must be able to provide for the medicines, no? Psychotropic medications, because some people develop depression, anxiety, and some can have aggravations of their pre-existing mental health conditions, for example, schizophrenia. So we also must be ready for these kinds of psychotropic medications. Yeah, so this completes our package of services in emergencies and disasters. All right, so next slide, please. Okay, I think this is the most important slide, I think, because here I want to give you an idea what does the Department of Health do in responding to emergencies and disasters. So the way we do this now during COVID, it's still the same. So first, we maintain an operation center. So an operation center is important because it helps us monitor the different events that are happening. So especially when it comes to natural disasters, we have to be linked with the what we call the forecast agencies. So when typhoons come in, so we need to be able to pick up that pag-asa forecast. So when we get all of these important inputs from forecast agencies, from PHIVOX, from Pag-asa, even from BFAR when it comes to shellfish poisoning, uh, etc. So we would always issue out what we call weather alert memos. So this is an important thing that we need to do. So this is when we alert all our units, our hospitals, our regional offices. So this is the start of what we call our code alert system. So I know that you must have heard about code white, code blue, code red. So all of these are part of this system of early warning and alert that should lead to response. So when we issue out alerts, uh, centers for health development, hospitals would also be on alert mode. So being in alert mode is important, especially in relation to the next one. So we are part of the NDMC family. So the DOH sits there. So when we anticipate the consequences, for example, of typhoons and other disasters, we do what we call PIDRA or pre-disaster risk assessment. So like for example, for typhoons, we monitor its entry into the Philippines. We monitor where it will pass through. We monitor how's the wind gonna be, the gustiness, and more than that, the impacts. So the actions that would be an offshoot of this would be we put on standby our teams. We'll stack up on logistics. So we'll monitor our TTMFs. So now when we do our pre-disaster risk assessment, it is already common practice now because we have COVID. We monitor also the status not only of evacuation centers and hospitals, but also our TTMFs and vaccination centers because these are what we call critical infrastructure as well. Okay. So of course we cannot afford to have problems in any of these facilities. So we monitor their status because we need to be able to be here to provide support to them. No, for example, if they need to evacuate, if they lack this logistics, no, if they need to be augmented in terms of health human resources, if a hospital needs to be repaired right away to continue its services. So many things. For example, if a vaccination center needs to suspend its operations because it is in the typhoon path. So many scenarios should be thought of in terms of this. So we make sure this is part of the disaster plans that they are developing or updating. Of course, the importance of health promotion and observance of our minimum public health standards. So this is so much a part of what we're doing now in the during the time of COVID. Like in after big typhoons, wherein there's going to be big displacement of people. The common problem there is yung density, di ba? So distancing should be looked into in the context of minimum public health standards. For example, if we are to distribute relief, so that can also be a super spreader event, right? Technically. So we have to be particular about these procedures, how they're being done. And this is the big function of the Department of Health being lead of the health sector if we need to mobilize response teams, we do this. We also would augment logistics. But now, in the time of COVID, we would usually be augmenting as well our PPEs. So aside from the usual medicines, PPEs would always be a common requirement now. And sometimes we can tap our funds to provide financial aid or support. So in the Department of Health, we have access to the Quick Response Fund. So that QRF is being utilized now to support the different operations. And when there are big disasters, we also use that fund. And there are situations wherein our resources would not be enough. So we need to coordinate also with our response partners. So I'd like to say this is our best practice. So even before COVID, this is already existing. So we have to have a way of coordinating with our response partners and stakeholders. So most of the people that we need, most of the partners are actually already part of the NDMC mechanism. So this is mirrored from the national to the regional up to the local levels. Here we can coordinate with our health sector and health cluster partners. So for different purposes, for different requirements operationally, uh, we're proud to say that this has been very beneficial to us in the DOH. So with COVID response, so with response to disaster, so things are more efficient now, and we are building on this very important system that we have built over the years. So I think when we do response, we need to be able to use existing systems. So sometimes it's a challenge how you put these things together. So of course there were some struggles, especially when we were at the outset. No, there were questions like last year. I can remember, what mechanism should we tap? What mechanism should we activate? When in fact most of these partners are also part of these two mechanisms. So yeah, I think coordination for the most part is very crucial in the big work of health responding to these different eventualities. Next slide, please. All right. So just to show you some of the beautiful knowledge and communication products that we were able to develop in collaboration, of course, with our Health Promotion Bureau, we were able to deploy this social media. We would also provide this to our counterparts. So this uh, we can say has been very helpful, no, since last year. So we started disseminating this to people, and we heard some very good feedback about this. And this is translated to different dialects as well. So people would usually say that these are very important materials that they want to be getting more from the Department of Health. So here you can see we have an emergency evacuation communication package. So we even what to put inside your go bag. We have a wash tip sa kalamidad, no? So this looks good, and the content is also very rich. So very important for saving lives and doing the necessary measures in the middle of emergencies. Next slide, please. All right. So I mentioned this already. I really think that the DOH partnership with the NDMC was able to help us in strengthening our preparedness efforts. So, of course, this is very important in disaster management. Yung unified command, no? Governance, leadership, and coordination. So, incident command, no? So, this has to be in place. And we have to do all hazards risk management. And yeah, like what I said, for the most part, we were able to apply most of this to our COVID-19 response initiatives as well. Next slide, please. All right. So what's our endpoint? So we are faced with COVID. We are managing a lot of emergencies and disasters. So in the health sector, of course, we are looking into health resilience. So in the context of our development plans, in the context of recovery, so this is what we are very busy about, building health resilience. So as defined, health resilience is the capacity of a health system to absorb. I mean, shocks, emergencies and disasters are gonna come, but we need to absorb all of this. So not only that, we also need to adapt. So we need to adapt the way we deliver our services. And more than that, we need to transform also the system. So we still retain control over our structure and functions. Okay. So the health system is only as good as what health services it is able to deliver, especially to people who are affected by emergencies and disasters. So it might sound simple, but there are so many strategies and mechanisms to make this happen. So the approach should be holistic. So if you look at the resilient health system, here we look at the different building health system, the way we deliver the services. It's also a product of leadership and governance, uh, health financing, medicines, vaccines, technologies, all the logistics. It's also a function of quality health information. And of course, the important role of health workforce. So some of these things are building blocks where we still have challenges on, no? So we are looking into this as we build our health system. And here, when we talk about resilience, the important dimension here is community resilience. Yeah, so we need to also look into how we reach out to communities. So the narrative last year when Ulysses happened about what really resilience is all about. So there were some narratives that resilience is not a good concept because it's a way for government to pass the accountability to people. So you remember that narrative last year. So resilience has to be built at different levels. So community resilience, but we also need to see resilience by way of good governance. And we also follow here our NDMC framework. We have strategies that are related to prevention, preparedness, response, and recovery. So this is also a framework that we are using now as we do our national action plan for COVID-19. So we're now doing the part 4 of that plan. So I'm glad to say that all of these concepts are being internalized. So some of this really feeds into our COVID-19 uh, plan, for recovery. So next slide. This is my final slide. So this is a very good visual depicting our vision. So we use this in our bureau to communicate our advocacy regarding health disaster safety in the hands of the community. So in Tagalog, we call this kaligtasang pangkalusugan sa kalamidad sa kamay ng komunidad. So here, saying that the bottom line of all strategies, whether disaster, climate change adaptation, all of this boils down to human health. Okay, so health resilience must be addressed. Local practices can offer services in a way that's sustainable. Our aspirations are have changed dramatically. So before, we used to just be concerned about managing disasters, just responding to disasters. But now we are very particular about making that move, that paradigm shift to now building resilience. Of course, it has to be built at that level in the community. So in the universal healthcare, Disaster management in health is so much a part of that, but resilience is an important narrative that is in the picture. So we want to see that community health resilience really is appreciated at the local government level. So the Department of Health has to come up with a very comprehensive package to make this happen. So we have what we call a 5K package as well. So we do a lot of initiatives pertaining to kaalaman. We want to impart knowledge in terms of all of these things and concepts. We need to support communities in terms of risk assessment. This is important in their exercise towards planning. Advocacies are very important. So we have to make sure that disaster management, preparedness, and resilience are part of the top priorities of governance, no, at different levels, especially in light of the coming elections. This is very important. The Department of Health has invested a lot in terms of kasanayan. We are particular about teaching skills for saving lives. We have a lot of different trainings that we are providing to our responders, to our managers and leaders. And technical assistance wise, we also are doing a lot of activities related to planning. Our concern now with vaccine operations in light of typhoons, power outages. So now we are preparing for tabletop exercise, uh, looking into the preparations of our local vaccine operations. No? And kagamitan, logistics is an important component. So we provide logistics support and sometimes money. And yeah, kapatiran, of course, the importance of partnership and linkages. Because disaster management is really all about multi-sectoral efforts that should be done, and multi-sectoral efforts are also very important in our fight against COVID. So the way we do COVID response, the way we do response to emergencies and disasters are the same. So we just have to make sure all of the needed strategies are being done. The end of the day, yeah, resilience is a term, it's a concept, but we have to make sure our people really know, no, how important this is, no, how this must be done. So communication, we cannot overemphasize, is very important. So I hope I was able to give you some insights regarding this very relevant topic, and I hope this can help a lot in the way you do your important job of communicating, what needs to be communicated to people, so people adopt healthy behaviors. So at the end of the day, we save lives, and yeah, we contribute to the our society as health. So with that, thank you very much, and yeah, I'll be glad to take your questions
Thank you,
from
Dr.
this point.
Ronald, for the presentation on disaster preparedness and resiliency. So even with the COVID-19 pandemic, we really have to be prepared for possible emergencies and disasters since they could happen anytime. So hence, it's important to consider preparedness in a disaster preparedness in our COVID-19 response and build health resilience in our health system. So let's move on to the open forum po. So for the first question, let's have Red Mendoza. Red.
Hi, good morning. Good morning, Doc Ronald. Hi, Jolo. Siguro just one question lang po siguro. How is DOH prepared? Well, you said nga po that DOH naman is prepared. Pero we all know nga na yung disaster preparedness natin always goes hand in hand nga with the COVID-19 pandemic and of course nga with the current vaccination efforts. Pero yun nga, right now some schools are being used as evacuation as vaccination sites, and there's a possibility na baka gamitin din silang mga evacuation centers in the long run when severe storm happens dito sa locality nila. So the question is the DOH prepared to ayusin, mabilisan kagad na i-move ang vaccination site from a school to a more safer location, like for example a mall or any other structure na at least hindi maapektuhan kung sakali magkaroon ng bagyo and biglang kailangan ng evacuation, kasi most of our schools are being used as evacuation
Evacuation
centers.
centers. Okay, thank you so much, Red, for that very relevant question. So that is an important scenario that we are looking into. So all the local and regional VOCs, no, vaccination operation center, are including that in their plan, no. So some we would have to really, there might be scenarios in which we have to move. And to do that, of course, first we need to evacuate, leave the premises, and we have to make sure things are being done in a manner na seamless siya at wala magiging mga what we call collateral damage. And of course, dapat nasusunod pa rin yung minimum public health standards, no? Kasi we understand that we have already designated, di ba? Itong mga iba't ibang vaccination centers. So, kino-consider 'yon, no? Kaya we came out with guidelines sa DOH, no? In terms of looking into the structure, baka may chance pa na palitan nila or yung mga contingency measures nga. So, dapat na-identify na ngayon yun. So isa to sa mga planuhan. I can say that some regions have already included this in their plans. So we're also working this out, of course, with the private sector. Yan. So kausap din ng DOH, of course, like for example, PDRF, no? So we're able to tap our other partners as well, no? Especially sa yung mga power outages. So yun yung mga efforts na ginagawa namin, and in the next few weeks we are scheduled to have a tabletop exercise. So now we are coming out with a memo regarding all of this public service continuity planning, and kasama ito, Red, sa pinagtutuunan namin ng pansin. So we have to be prepared for this, and ito yung initiatives na ginagawa. But in terms of resources, kailangan lang ma-identify kung saan kukunin, no, kung ano facilities yung gagamitin. So that's what I can share, Red. Thank you.
And last na lang siguro, I heard that there will be an earthquake drill this coming week. Thursday ba yon? I see Thursday.
Yeah.
Meron bang component dito na parang magkaroon ng earthquake drill sa isang vaccination site in the event na, knock on wood, magkaroon ng earthquake sa isang vaccination?
Yeah.
Have we included that sa ating earthquake drill?
Yeah, kasama yun sa mga scenario. Actually, when we say natural, kasama lagi dun yung earthquake. Like what I said, yeah, we've been monitoring pretty much high magnitude earthquakes, and when they do their planning kasi, they must be mindful of the common hazards that affect their place, no? So we have to really push this scenario to be included in the plan kung talagang meron. Let's say some parts of Mindanao, di ba, have been experiencing this. Saka importante ang earthquake, no? Because earthquakes are important. For one, earthquakes can also cause power outages. So that can also compromise our cold chain. So this is also one of the scenarios na kasama. And earthquakes can also lead to a secondary hazard, a fire, diba? So common din yan. So yun, kailangan sa tabletop, sinasubject natin yung plan nila to the interplay of these different hazards. So hindi natin pwedeng isipin na linear siya, na itong hazard na to. So one hazard can happen on top of the other. So COVID ito, pasok si bagyo. But some hazards can happen, one on top of the other. It can also happen one after the other. So dapat dynamic yung interplay na yun. So yun yung mga tinitingnan namin sa mga plans nila. Pero dapat matest yun, Red. That's why we will prioritize yung testing talaga. I-drill dapat yung mga ganong klaseng plan. And we also want to see this at the regional level. So ang target talaga namin ngayon yung mga regional VOCs, no? So yun, dapat merong sharing of resources, may contingency measures. Tapos nililink na rin namin to sa NDMC structure. Kasi kapag usapin ng evacuation, kapag usapin ng transfer, tapos hindi lang tao ang kailangan mong ilipat dyan, yung gamit, yung equipment, no? Kailangan meron kang kuryente, yung lifelines. So yun yung dapat ma-cover din ng DREAMC response mechanism if and when talagang kailangan. Pero kung may iwasan naman na huwag humantong doon, mas maganda. So naglabas kami ng checklist, Red. So we call it the 6S of a vaccination center kung paano natin siya tatawagin na safe. Unang-una, yung location, no? Dapat safe yung location, tsaka accessible siya. Pangalawa, dapat sound yung structure niya. So ito yung importante sa preparedness sa lindol, no? Halimbawa, kung talagang natag mo na yung vaccination center mo ay guguho yan, dapat hindi na yan. So ito rin yung dapat nating ipaintindi na maayos doon sa the way we assign or designate itong mga vaccination centers. At kung kailangan palitan, yun yung mga dapat na mga desisyon na gawin na ngayon, no? In light of earthquakes. Sa typhoons lalo na. So lalo na ngayon sa Eastern Seaboard. So dapat yan yung mga i-prioritize natin. So we're doing that for the design of our tabletop.
Okay.
Yeah, Red.
Okay, sige. Salamat, Doc. Salamat, Jolo.
Okay.
For the next question, we'll have Isa Umali from DSWB. Isa, you may now ask your question.
Good morning, Dr. Law.
Yes, good morning.
Good morning. Kanina po nabanggit nyo, isasabay sa earthquake drill yung drills sa vaccination centers. And speaking of vaccination na centers, sir, meron po ba kayong mga namomonitor na halimbawa, mga kulang or mga dapat pang i-require sa mga vaccination sites na ito bilang preparations na rin syempre sa mga emergencies like nabanggit nyo nga po kanina, lindol, bagyo, and brownouts. Thank you po.
Yeah. So as part of the checklist, dapat ma-monitor nga yung lifelines din, no? I-check mo yung kuryente, yung stable ba siya, kung meron ba silang halimbawa generator set, kung yung generator set ba nila, yung ba yung appropriate, kasi may iba-ibang requirements yan eh. So yun yung mga dapat tingnan din, no? So dapat yun, ngayon we are disseminating the checklist. So yun yung mga dapat mangyari. So sana na-cover ko yung tanong mo.
Okay, let's move on to the next question. Aiko?
Yes po, good morning, Doc. Good morning, Jolo. Opo, Doc, how will we strengthen symptom screening protocols in housing evacuees, especially with the existence of different COVID-19 variants? Some are symptomatic and might be positive for COVID-19, although it might be challenging po. But will we also consider recommending the use of rapid antigen testing, especially in communities with prominent rise of COVID-19 cases?
I think we will have to defer that question to our epidemiology team siguro, no? Yeah. But yeah, I will take note of that, no? So there are different guidelines kasi in how to go about the different tests, no? But yeah, I'm afraid I will have to refer that question to our epidemiologist. I hope that's okay with you, Aiko. Yeah. So maybe Jolo and team can take note of that, no? So we'll do our best to find some answers to your question. Yeah. So I myself would also like to know the answer to that. Yeah. Just to guide, because it's important sa interventions that we will have to do, no, in the community, especially in the sa evacuation center, you know, where we put the people there. So that is very important. Aiko.
Doc, another question po. During evacuation, what are our measures simple to those who are on home isolation? And how are we going to screen them po if ever there is no available TTMF in an area? What are our measures for what place will be housing them, or ano po yung mga measures po natin or recommendations where we could accommodate these people who are on home isolation?
Yeah. So of course, we'd like to think sana that when they're in home isolation, okay sila doon where they are, no? Of course, it would usually be more complicated kapag yung ililipat pa natin sila, no? So we really have to come up with that big decision kung talagang kailangan. So it's important to note this in a community. So we have to have a database siguro. Alam dapat sa community kung sino yung mga yan para alam natin yung mga desisyon na kailangang gagawin. Let's say one whole community in the path of yun nga, pwedeng typhoon or storm surge. So dapat alam natin yung mga ganun nga, oo. And dapat ready rin yung ating referral system, no? So dapat gumagana din yan in emergencies and disasters. So yung timely updating kung saan talaga yung may bakante, no? So that will form part of the response. But we have to have very accurate information on that, no? Pero sana sa mga barangay, na-check talaga din natin yung quality, no, or conditions ng mga tao when they do the home isolation. Yeah. So just like in other countries, ang policy naman nila, hindi naman talaga sila katulad natin na yung naglalagay sa evacuation center, di ba? So pretty much stay in place sila eh. So actually mas safe naman talaga yon, and mas less yung risk mo doon eh, in terms of kapag when you pull people in one area, yun yung hindi conducive kasi. So disease transmission can happen. So kung hindi man COVID, we have to be concerned as well about other communicable diseases. Say for example, patients with active tuberculosis. So you have to know if a patient has that condition, no? So yun yung mahirap na, for example, imimix mo siya sa iba din, no? Regardless kung may COVID o hindi. Yeah. So those should be part of our surveillance systems, should be part of our information systems. So yun yung dapat basis when we come up with our evacuation plans. So ang sagot ko doon, dapat granular talaga yun. May mga ganong detalye. Kasi hindi tayo pwede magkamali sa mga ganyan. No? Yun nga, we might be able to do a successful evacuation, di ba? For example, no lives lost. Pero some people might end up getting, diseases because of transmission. And isa pa yan, yung lifelines. So we're monitoring also, di ba? Remember, yung quarantine facility. So ganyan din naman yan. Dapat may tubig, may kuryente. Halimbawa sa evacuation center, importante lagi dyan yung tubig, no? So kung gagawin evacuation center yun, so we have to ensure may supply ng malinis na tubig. Very common cause kasi yan of outbreaks, no? So we cannot afford to have these incidents happen. So these important systems must be in place pa rin in the local community. Thank you.
Right, thank you.
Okay. If there's no more questions from our media partners, maybe Dr. Ronald, you can give your final message na po to our viewers.
Okay. So again, thanks for this opportunity to impart what we know, what we have been doing about this important and relevant concern. So the way we address COVID, COVID is a disaster in itself, but we should not forget about all the other problems that we have. So even if we have a very good COVID plan, if we don't address emergencies and disasters, if we don't include that in our plans, we'll have big problems. And that can have disastrous consequences by themselves. So I think preparedness is key. But when we're able to really fight COVID, when we really say we're done with COVID, we need to be effective, really, na talaga maging resilient yung ating health system. So I think all of us must do our job for us to be called a resilient society or a nation. But resilience must be built at different levels. So I think communication-wise, we really need to communicate, relay that message that resilience is not only about government. It's not only about government providing services. It starts with local resources, local connections, local information, local knowledge that when translated into something can already comprise resilience. But government still must do its part because the job is tough. So community resilience, better governance, I think those should go hand in hand. And that's what I think about resilience really, looking at COVID and this other emergencies and disaster. So thank you for your support to the Department of Health, and I hope you continue being safe and be blessings to our fellow Filipinos. Mabuhay kayong lahat. Salamat.
So that's it for our Kapihan today. Thank you, Dr. Ronald, and everyone who joined us in this Kapihan. Ha. Okay.